So we all know somebody with a mental illness. We may be that person with a mental illness. In our research here at LSE in the Care Policy and Evaluation Centre, we are doing work which is looking at many aspects of mental illness, particularly the causes, the consequences, and then how we can prevent and treat mental illness in ways that are appropriate and affordable within our health system and other contexts. There are economic causes of mental health problems. Poverty is a good example, unemployment, deprivation more generally, debt. There are economic consequences, so mental health problems can cause work disruption, so people lose income, employers lose productivity, the health system needs to respond, criminal justice system might be involved, and so on. And the third thing we look at in our research is then to think about how we can use economic arguments to help to make a better case for preventing mental illness, if that's possible, and responding promptly to mental health problems when they emerge. So we work with policy communities to help them to improve the mental health system. It's estimated that about 20% of women will experience a mental health problem during pregnancy or in the first year or so after they've given birth. It's very, very common. It's almost always missed and not treated. And so we've been doing work to understand what the consequences will be for the woman and for the child. And some of those consequences will last a lifetime. And many of them will have big economic impacts. And then we've been looking to see how we can change that by helping midwives and health visitors to recognise mental health problems, maybe respond to those problems themselves by better training, but certainly get people in contact with services. And that has huge payoffs for society. We're particularly interested in our research in the continuities over the life course, because things you experience in adolescence, such as depression or anxiety or schizophrenia, can have consequences for the rest of your life. And we're also interested in how we can turn that evidence on causes and consequences into a case for better services, better policy frameworks to prevent and respond to mental illness. One of the projects we've been working on has been to look at interventions which we know already work in the sense they're effective, but to see what they would cost to put into place and what would be the payoff in terms of better health, better quality of life, and maybe savings of doing that. One of them, for example, would be looking at schools, where we've been looking at an intervention which has already been shown to be effective to prevent bullying. We've been looking to see what would be the economic case for this intervention. And what it does, it reduces the amount of bullying. It also makes school students more resilient when they experience bullying. And that will mean that they are better in the school, there's less disruption in the school, their educational attainment will improve, and so on. Another example would be in the workplace, where employers can be better at recognising when somebody is under stress, perhaps putting something in place to help them, signposting them to services. That will reduce absenteeism, it will improve productivity. There's a clear economic case to the employer, even though the primary concern for all of us ought to be the well-being of the individual. So those are two of the examples. We've also worked in communities, in parts of the health service that aren't normally linked to mental illness, in a whole range of other settings, to try to understand how professionals, staff working in those settings can recognise when a mental health problem might be beginning to develop, and then getting people in contact with the right support to stop it getting worse. What we try to do with our evidence is to generate it in the best way we can, really good research, but we try to communicate it in a way that then people who take decisions can use it if they wish. So head teachers in schools, or employers, or people working in the health system but maybe not normally engaged with mental health. So we're trying to find ways in which people can use this and see the economic arguments for them as well as for the wider system or the wider societal context, if you like. So getting that economic evidence out in a accessible, understandable way is really important. Mental illnesses are common, but they don't have to be inevitable. We can't prevent every mental illness, of course, but we can do better at preventing some, or if they emerge, at responding quickly and appropriately to support people, to treat people. I think during the pandemic, we've become much more aware of the stresses that many people experience. We've all experienced probably in some way. And I hope we've got better at understanding how we can support each other in this. The health system has got better at responding quickly as well. That's not a criticism, it's just an inevitable challenge they've been facing. So I think what we need to do as a society is just be more attuned to some of the risk factors for mental illness, and some of those are economic in nature, and be better placed to respond when those problems emerge. And again, some of the consequences that we've shown in our work in the economics area are huge, and that helps, I think, to persuade decision makers to pay more attention to mental illness.